Hi, I'm Dr. Lisa Simpson, President and CEO of Academy Health. Welcome to our Future of HSR interview series. As Academy Health celebrates 40 years advancing health services research and health policy, I wanted to build on that history to look forward at how our field is changing and how we might align our work towards higher impact, more equitable research in the future. In this series, I'll be talking with leaders in health services research, in health policy, and innovation to reflect on where we've been and, more importantly, where we're going next. Today, I'm talking to Dr. Andrew Bindman, the Executive Vice President and Chief Medical Officer for Kaiser Foundation Health Plan, Inc. and hospitals. Now, Andy, I'm very excited for our discussion because you have been part of this community and this field for, well, let's just say a few years. In fact, Andy and I first met when I was doing my postdoc at UCSF. So as you think about this field of health services research and where we are today, Andy, I want to know, as a health system leader, can you talk a little bit more about the role of health services research in your work?
Well, thank you, Lisa. What a great opportunity to be here with you today. In my current work as the Chief Medical Officer at Kaiser Foundation Health Plan and hospitals, I find health services research to be an important part of how we drive quality improvement and innovation throughout our health system. We're really fortunate at Kaiser Permanente to have a robust set of health services researchers who work very closely with our clinicians to address timely and relevant questions. And because of the way that they collect information in the context of our delivery system, are able to then use that information to actively implement important findings from that research that really can be transformative in our delivery system. One of the things that I'm trying to do also as the quality leader for our organization is to integrate and weave strategies of health services research into how we conduct operations to do quality assurance and quality improvement. So, for example, we have a very active program underway to systematically measure our health outcomes through the lens of equity. And so I'm using the tools of health services research, rigorous scientific methods, to make sure that we have valid estimates and assessments, I should say, of our health outcomes, and are able to stratify that information through race, ethnicity, SOGI, and other important social determinants, so that we can evaluate our quality in a robust way and drive toward improvements and address any inequities that we find.
Fantastic. That really is kind of like, as they say, where the rubber meets the road of research in practice, both generating better evidence and then applying what we learn to improve outcomes and equity. So I want to shift gears and kind of give you a chance to reflect a little bit, because throughout the span of your career, you've had really important opportunities to shape our field of health services research. I mean, you served as the director of the Agency for Healthcare Research and Quality in the Obama administration, and you were also editor-in-chief of one of our premier journals, the journal Health Services Research. So as you did those things, how did they maybe change or inform how you see the field today and how it's been evolving?
Well, our field is really a remarkable one, and I've been so fortunate in my career to be in different platforms to observe our community in all the ways that it contributes. At ARC, I had a chance to support researchers, particularly excited about those at the junior end, and to be able to invest in them and to sort of see them in the same way that maybe someone who's planting a forest for future generations can see how an investment can lead to the development of new areas of investigation and new strategies to do it. That was very exciting. And then, as you referenced also as a journal editor, to get to see out over that forest, to be able to see the field and to be able to harvest the really exciting work that is coming up, both on the method side as well as on the applied side. And if anything, that's what I guess I would say I've seen as my career has grown, is that I think health services research was a field that was first named for its work in methods and trying to apply methods to very real life problems. And what I'm excited about in our field, and what I'm increasingly playing a role in my role at Kaiser Permanente, is taking the results of that research and trying to turn it into action. I do think that our field is particularly strong in being able to look back to see, gee, how did a policy, or how did a practice change? How did a natural experiment lead to us being able to learn from that, looking back? And I think if there's any place that we need to continue to try to grow our field, it's in taking the lessons of that and in a more timely way, applying that into real change, so that we aren't so much historians, but are in fact active shapers of the future and quality improvement. And I do think the way data is now being collected and the way that our investigators are really being embedded within policy roles and within roles within health systems, there's a real opportunity to do that.
Andy, you have laid out a number of the ways that health services research has had an impact and been so useful to improving health and healthcare. And yet, we can do more and we can achieve higher impact. So, as you think about the field, what are some of the opportunities and challenges where we have fallen short and where we need to focus to really have the impact we seek?
I would love to see greater partnership between health services researchers and decision makers. For example, what I observe at Kaiser Permanente and what I've observed at other health systems is that we still have a ways to go to really meet the promise of learning health systems and what it really means to connect evidence with change and decision making. And part of that has been the change of the researchers and recognizing the nature of the questions that need to be asked and answered in more timely ways. But we also have to do a better job of connecting and communicating with those who could make use of our information. We can't communicate it in these technical ways. We need to find ways to efficiently be able to identify the relevance of our information and what action steps should be taken. Lisa, we've sometimes talked, and I've been critical of when articles would sometimes come into, whether it was the Journal Health Services Research or other journals that I was reviewing for. And sometimes I'd find researcher would say, here's our results and they have implications for policy or for health system change, but they don't tell us how to do that. And I think we need to take those next couple of steps and not just assume that those who are in a position to act on our knowledge know exactly what the next steps are. And so I think we can play a greater role in connecting the dots of not only the meaning of our research, but also what are active next steps that could be taken to put it into action. And I know that sometimes is going to differ based on the circumstances and so forth, but I do think we can be more active in trying to communicate that so that we can help partners to actually make use of our evidence in those kinds of ways.
Andy, one of our strategic priorities at Academy Health is advancing the diversity, equity, and inclusion, not only of our field, but our field's impact on health and healthcare. And so I wondered, again, given where you are today and where you've been in the past, what do we need to do better, differently to really, truly advance equity?
Well, Lisa, I couldn't agree with you more that equity really needs to be front and center in how we think about the nature of the questions we ask in health service research, and fundamentally how we shape our healthcare system going forward to make sure that everyone is able to fully benefit from what it has to offer. I was talking with a colleague the other day, and they pointed out that, of course, equity was a fundamental part of the Institute of Medicine's, now NAM's, definition of quality, but somehow equity became the silent E in that definition. And, it's been 20 years, and I think it's time that we really double down our efforts to think about how we can address this important issue. At Kaiser Permanente, for example, we have committed as an organization to look at all of our quality metrics through the lens of equity, race, ethnicity, SOGI, where people live, and how that impacts their health and so forth. And one thing that I think would be really beneficial to the field as a whole to move forward is to align on what are the ways that we want to stratify our data to look at these important characteristics in similar ways so that we can benchmark and use data and measurement as a tool for improvement. And I'm excited about the number of organizations that are recognizing the importance of being able to look at our data this way, but we need shared leadership and agreement, consensus on those categories so that we can move ahead together and learn from one another.